can Ayurveda support your emotional health, especially if you are a sensitive person? Discovering this topic, we have Rose Carroll, who has been an Ayurveda health practitioner, body worker, and educator for the last 30 plus years. She's also a licensed professional mental health counselor who integrates both Ayurveda and traditional mental health psychology in her practice. I'm Amita from Nourish Talk, a global platform for natural and holistic therapies. I am super excited to introduce all of you to Rose Carroll, who's joining us live from Chicago. Welcome, Rose. Well, namaste, I should say that.
Thank you, Amita. So great to be here. And I'm very excited to talk about my favorite subject, which is Ayurvedic approaches to mental health. And yeah, so I just a little bit about my background, just how I got into it is in 1976, I was given a beautiful gift from my Aunt Doris. And she had recommended that I learn transcendental meditation as a teenager. I was 13 at the time. And I went into the center in Chicago and I heard an introductory lecture, and I was sitting in the back room with a girlfriend of mine. And at that age, we're kind of preoccupied with other things. But there was something about the teachers up front. I knew there was something I wanted. I knew I wanted from them. And it was like this, I guess it was a bliss or something I sensed that I wanted. So I learned how to meditate and it changed my life. I became just a more functioning teenager. As we all know that the teens are extremely challenging with all the hormone changes. And I just became a calmer teen, and I started focusing on my schoolwork, and my grades improved, and I changed friends. I had better friends who were not having such a negative influence in me. And after that, I decided to study Vedic science at Maharishi International University. I became a student of Maharishi Mahesh Yogi and studied that, and that's how I was introduced to Ayurvedic healthcare. So my interest in the development of human consciousness has been lifelong. I'm still studying it. I am a lifelong student, you could say. And then I became involved with the treatments of Ayurveda and learned how to do panchakarma. So I spent the last couple decades offering and administrating panchakarma treatments. Panchakarma is the body work aspect of Ayurveda, and they're very balancing.
Yeah, beautiful story. And did people know when you got into Ayurveda, especially, quite a few years back, probably people didn't know much about Panchakarma or Ayurveda.
Yeah, nobody knew much about it. I was in Seattle at the time, and Maharishi had invited us to open up a Panchakarma clinic, and there were some physicians that were trained. So somehow it kind of started catching on in the Pacific Northwest, and then throughout the years it's been popularized by Vasant Lad and different teachers like that. So so I've been doing it a long time, and I realized that the emotional mental aspect needed some attention as well. And so I actually went back to school in my 50s and got my degree in clinical mental health counseling. Mm-hmm. And I wrote my thesis, master's thesis. It's called Ayurveda's Approach to Mental Health. And so I started integrating both of them. And I'm hoping in this session together that you will come to understand how stress and anxiety and Ayurveda can have specific tools to help that in the realm of clinical counseling.
Sure. So let's start with a lot of people probably don't know what exactly Ayurveda is. Where did it come from? So let's just start from the basics, just to lay the groundwork, and then we move into, the mental health aspect of that.
Sure. So Ayurvedic medicine is a 5,000-year-old system of natural medicine. It comes from India, and it's based on the five elements, which is earth, air, fire, water, and space. And it's a natural system. It includes diet, behavior modification, body therapies, and herbal medicine. So when you see an Ayurveda practitioner, what they'll do is they'll do an assessment to understand the five element. Everyone has the five elements of earth, fire, water, air, and space. But everybody is born with a different amount of these elements. So when you're born, it's what's called your prakriti. That's your nature. So some people have more fire element, some people have more air element, some people have more earth or water element in their physiology. And the mind and the body are very connected. So whatever is happening in the physiology affects our mental experience as well. So we all have we're all a very unique combination of these different elements. But over time in childhood, we have different experiences. So we have what's called like we get away from our nature, that is called Vakriti. So Vakriti is the imbalance. So what the Ayurvedic practitioner does is to go back to what is in balance for you. So we're going to talk about what these different, how these different elements will show up in the physiology. So for example, like on this chart, we have, these are Sanskrit words. So Vata dosha, these are just ways to explain and understand the different elements in the body. So Vata is comprised of air and space. Pitta is fire and water, and Kapha dosha is water and earth. So somebody who, so everybody looks a little bit different because of the different amount of elements in the body.
Okay. So do you want to talk a little bit about how it benefits, especially being sensitive from an Ayurveda perspective?
Sure. So there's a researcher, her name is Dr. Elaine Aron. I don't know if you've heard of her, but she wrote the book, The Highly Sensitive Person. And it's been widely researched now that there about 20% of the population is what's called highly sensitive, or sensory processing sensitivity is the other word for it. And it's not actually a diagnosis, it's a personality type.
Yeah.
But there are very, very specific components to it. So I mostly work with sensitive people. I seem to attract sensitive people. So if you're on the phone call today and you're sensitive, you'll understand. So some of those attributes would be somebody who has empathy. They tend to be intuitive. They're very aware of their environment. So if they walk into a room where there's been an argument, that they could feel that very easily. They're very sensitive to the senses. So bright lights, overpowering odors, sudden noises, even to stimuli like, watching like a violent movie or the news can really make somebody who's sensitive overwhelmed. So what I do with that is I help to reduce overwhelm and to help reduce overstimuli. That can also look like anxiety or depression in somebody who is sensitive as well. So Ayurveda has a number of tools and ways to help somebody who's sensitive. Yeah.
Okay. So yeah, you mentioned a little bit about the Vata, Pitta, Kapha. Do you want to add a little bit more on these different body types?
Sure. So Vata is considered cold, it's dry, and it's unstable. So in the physiology, you may see that somebody who might be thinner built, their skin is thinner, you can kind of sometimes see their veins through the skin.
Yeah.
Have dry skin. Their personalities tend to be spontaneous, kind of impulsive sometimes. They're fun to be with. They're kind of vivacious. So that, like I said, we all have all the elements, but some people just have more vata, more of this air and space. So that looks like in the body as these characteristics, as I mentioned. So when it's imbalanced, it's fun and spontaneous, it's enthusiastic. But if we accumulate too much air and space in the body, it can go out of balance. And that would look like, restless or inattentive. It could be insomnia, constipation, overall dryness in the mind and the body. So we want to balance all of that out. So what I'll do is I'll go over the different body types, and then I'll talk about different ways we can balance those. Um, so um, so pitta is made out of, it's the fire and water element. And I like to say hot water because it is fire. So that's people who have that pitta or fire and water predominant in the physiology happens to be, it's kind of a medium build. They may have lighter skin, have prone like to more freckles, and they are more athletic, more competitive. It's a very about transformation. It's fires about transformation. They tend to be good leaders, good speakers, articulate, strong intellects. But when it's out of balance, it leads to inflammation, because we know that inflammation is like heat in the body. It's a fiery element. So, and that would translate into autoimmune and thyroid issues. It could also translate into skin issues, skin problems, and inflammatory emotional responses such as anger and irritability, impatience, things like that. So if you have a pitta imbalance, we want to balance that out. It's very easy actually to balance these things with food and behavior and different body treatments that work amazing for that. And then we have the third element, which is kapha. And so kapha is derived of earth and water. And so with this particular body type with earth and water dominating, they have bigger bones, bigger muscles, they may be heavier set. They tend to do things more slowly, more methodically than the other body types. They have if it's out of balance, they have a tendency to have weight gain, diabetes, different things like that. And the mental component is, when it's in balance, it's very nourishing. Kapha friends are very loyal. They're the type of person you could always get a hug from, very affectionate. But when it gets out of balance, kapha, when it's too much, it can turn into depression, kind of heaviness, lack of motivation, procrastination. So all these have their balanced aspect, and then they have the imbalance. And what Ayurveda does is try to get back to the real nature, the core nature of balance. And so through herbal medicine, through diet, through exercise and behavior modification, body treatments, we can get all these what are called doshas back into balance. It's a constant sort of, on the surface level, there's a constant change that is going on depending on what season it is, or what's happening in the environment, what our diet is, and whatever circumstance we're living in, that the climate we're living in. So there's always a dance of balancing the doshas.
Yeah, we hear a lot about the imbalance of the dosha and how it can get into the medical condition, as you mentioned. But today's topic is, okay, so let's just talk about a little bit on what are the challenges and recommendations of a vata type mean. We talk about the vata, pitta, and kapha, especially who's someone who's a more sensitive person. And we talk about all the three ones, one at a time.
Yes. So some of the challenges with a vata imbalance is overstimuli. So that means if you go into a store or something, it's overstimulating. Like a lot of people, like they can't stand going into a big department store because of the lights, and then there's odors from the chemicals. So what that looks like is, what I call it is overstimuli. According to the highly sensitive person language, you could say that would be overstimuli to the senses. It's uncomfortable. You just want to run away. And it may look like if you're socializing at a party, then, or you're at a restaurant and you're hearing too many conversations at once, and then it's hard to concentrate on what the person is saying, who you're having dinner with. So that's also considered a type of vata overstimuli. It could show up as anxiety, where the mind is just overthinking all the time, and it makes it difficult to go to sleep. So that shows up as insomnia. So there's different ways to address it. One is to balance vata. What vata needs is warmth. So if vata is cold, dry, and unstable, and we're just skimming the very surface of this knowledge, by the way, because it's a basic introduction. But what vata would need is warmth and unctuousness or oiliness and stability. So could be one thing that I highly recommend is something called Abhyanga, and it's a oil massage. You do it with like an herbalized sesame seed oil base, and there's different herbs that can balance that vata out. But it would be warm oil, and you would just apply it to the limbs and the lower back and the scalp. You do like a scalp massage in the face, and you do that in the morning as a way to balance a vata dosha, because vata is dry. So the warmth of the oil and the unctuousness of the oil helps to balance that. And then you shower that off, and then you start your day. You can also do it at the end of the day before you go to sleep to help with sleep. And it sounds really simple, but it actually really works. I've been, like I say, I've been recommending that for over 30 years. And a lot of people would come into the office. I was start off as a health educator for an MD back in Seattle. And, nobody heard about Ayurveda before. They're like, what? You want me to put oil, massage myself with oil? I go, yeah. So there was some resistance, but then they would come back for follow-up, and they really noticed a big difference of feeling calmer during the day and more centered, less scattered, and just a general feeling of well-being, because it balances Vata. Vata is the lead dosha, and it has a very smoothing effect on the whole nervous system. You can also receive Abhyanga. So if you go to an Ayurvedic hospital or clinic, then traditionally they have two clinicians giving you a 1 hour warm oil body massage, which is heaven on earth, is very, very settling, amazing for sleep disorders, anxiety disorders. There's lots and lots of treatments. The treatments are my favorite part of Ayurveda. And it's really, Vatas really respond to touch. And now that, with this pandemic, we can't really go to these clinics, but you can do this Abhyanga on your own. Yeah. So that is, and also having warm drinks, warm teas, like with licorice and ginger, making sure that you have warm cooked food. I myself have a lot of vata, so if I don't have something warm for dinner, it's just, I'm not going to sleep. So even if it's, so avoiding raw food, avoiding cold food, avoiding skipping meals. You want to have regular meals, which is really hard for Vata to do because they're irregular. It's kind of unstable. They can't, when it's out of balance, it's all over the place. So start having warm cooked foods and warm teas on a regular basis. Lunch, breakfast, lunch, and dinner, and even like something hot to drink maybe an hour before bed. Could be some warm milk or warm almond milk with a pinch of cardamom in it, and a couple little white poppy seeds in the milk is really good for preventing insomnia. So there's lots of recommendations. So when I work with people, it's very specific to each person, very unique to each person, but these are kind of general guidelines. But the Abhyanga and the regular meals and warm drinks is the main thing. I just had somebody who had all kinds of, irritable bowel and all kinds of issues. And she just simply went from raw foods to cooked foods. And it just in a week, her digestion greatly improved. And it sounds so simple, but these things really work with all balancing the fundamental elements that we're all made up out of. So I always get really excited when I see such quick results from incorporating these very easy recommendations.
Yeah, no, I just wanted to add that there's a lot of research that has also been done, documented for Abhyanga, the massage that Rose is talking about, and also Shirodhara is another one that I've seen a lot of research, in PubMed, that how it helps with emotional health, stress and anxiety, and also sleep, all the things. So just wanted to mention the research part as well. So let's talk about Pitta and Kapha, about Pitta and then Kapha after that.
Okay, yeah, and I was going to say what Shirodhara. I just want to explain Shirodhara.
Sure.
So it sounds these treatments are thousands, like over 5,000 years old. They were cognized by the rishis. They saw it in their meditation, and so they're a little. If you're new to it, they're a little unusual, but they're deeply profound. So Shirodhara is you're lying on a massage table. And then there's a bowl of oil, warm herbalized oil, and it's like hung by a chain, and there's a little hole in the bowl, and then a stream of oil is going over the forehead and the whole head, and you're having that flow of oil, a stream of this oil over your head for about a half an hour, and people have like a meditation experience, and it really settles it's called pranavata, which is a subdosha of vata, which is responsible for mental thinking. It really makes it really quiet, and it's highly recommended for insomnia and anxiety. So if you can find a place that offers it, I highly recommend it. Okay, so Pitta. So as we know, Pitta is fire and water, and it's the hot one. It's the hot dosha, and it's responsible for inflammation of all kind when it's out of balance. So too much heat in the body will cause inflammation, especially if you are a predominant Pitta type. And one of the things is you want to avoid real spicy hot foods if you have a lot of Pitta. So a lot of people who have Pitta have like acid reflux and acid in the stomach, loose bowels. Could be a lot of irritability, impatience, and anger. So cooling foods you want to introduce to the digestion. So it could be like, basmati rice, cucumbers, squashes, something called lassi, and avoiding things that are heating, which is vinegar, onions, real hot, spicy chilies. You want to reduce all those heating foods and try to cool the body down. Coconut water is really good. Fresh coconut is cooling as well. There's a whole list of cooling foods. And also reducing coffee. Coffee can be overstimulating for somebody who's Pitta. It's very acidic. So I would recommend reducing caffeine and coffee products as well. And the treatment for Pitta is Takradara, which is like Shirodhara, but it's with herbal buttermilk. And it is very cooling to all the subdoshas of Pitta, and amazing. It also is good for insomnia as well. There's like a Pitta insomnia that is different than a Vata insomnia. There's a difference. So somebody who has predominant Pitta, they tend to wake up in the middle of the night, and the heat can wake them up. Whereas Vata, it's more prana Vata, which is dryness in the physiology. And it's creating this excess mental activity, so it makes it difficult to fall asleep. But you could have both. So you would have to have several recommendations based on those imbalances as well. But yeah, and pitta is really, I think, needs nourishment, it needs cooling, and it needs more rest, because they are more of somebody's pitta is can be more competitive, and they tend to be overworking a lot. So if they could rest more, meditate, do things that are activities like swimming in like a lake, if they exercise, to exercise when it's not the full sunlight, but either early in the morning or taking like a walk in the moonlight is very cooling for pitta as well.
Okay, so let's talk a little bit about kapha now.
Okay, so kapha is earth and water, and they when it's balanced, it's focused and motivated and affectionate and loyal and heroic. But when it's kapha is too much in the body, then that can be like a procrastination, depression, weight gain, and lead to diseases like diabetes and things like that. So what they need is less sleep. So the biggest recommendation that I recommend for people who suffer from depression and kapha imbalance is to wake up early. So there's the different times of the day, so that may be waking up before 6 a.m. So the kapha time of the day is between 6 a.m. and 10 a.m. So if you sleep past 6 a.m., that can increase kapha in the body, increases earth and water in the body. So it makes it more difficult to wake up. So a lot of people who, for example, has anyone, whoever is listening to this, where you sleep in, you think you're going to get extra rest, but then you just feel more tired and have more mental fog from oversleeping. So that's kind of a kapha, what happens when you sleep during the kapha time of the day. So my biggest recommendation for depression, and when I work with people with depression, is I want to understand, what time do you wake up? And a lot of times people are depressed, sleep all morning. It's hard for them to get out of bed. So the challenge is like the motivation. How do you get them out of bed? So that starts the day before with dinner. So that means having a lighter dinner earlier, because the digestion can interfere with sleep as well, and make it difficult to wake up. There may be ama there, which is digestive, what Ayurveda calls as digestive impurities.
Okay.
Yeah.
So moving on. So let's, you talked a lot about the digestion, but let's just understand the relationship between emotions and digestion.
Right. So, the mind and body are very intimately connected. So when you have a cold, and you're sneezing and your nose is running, it affects how you think. You can't think as clearly, and that's the mind. So there's this intimate connection between the mind and the body. If you're mentally and emotionally nervous about something, then that can affect the muscles from clamming up, and you feel stiffer. You're kind of holding yourself when you're feeling physically. It affects the physical body. And there's so much research done now on the intimate connection between the mind and the body, with biochemicals, and just, it's like instantly. There's a thought will have an instant effect on like our hormones, cortisol, stress hormones as well. And in Ayurveda, they talk about digestion and stress and elimination. So it could be somebody has irritable bowel if they're having a lot of stress. It can affect how we eliminate. Is if we're clenching up, if we're nervous or upset, that may, for some people, cause constipation. For some people, it may cause more of a looser bowel So our thoughts, our feelings, our emotion directly affect our digestive system. And you have this picture here of Agni. There's a concept, there's in Ayurveda, which is called the digestive fire, or Agni. Agni is fire. We all have uh, many different levels of Agni, but the main Agni is our digestion. And sometimes it's too low and sometimes it's too high. So oftentimes somebody who has a lot of pitta has the flame, the Agni digestive fire is too high. So it's burning food too quickly, and it can cause some acidity there. And sometimes, like somebody who has a lot of kapha, the digestive fire or the Agni is very low. So really, we have food, but the Agni is what cooks the food and creates digestion. So different spices and different things can increase this Agni or decrease it. But the emotions, coming back to the emotions, yeah, what we're feeling, we're digesting. What we're seeing, we're digesting. We're digesting all the senses, not just food. So, and that has a lot to do with perception. How we digest things is how we see things, how we perceive things. There's a concept in Ayurveda that all suffering in life, whether it's physical, mental, emotional, has to do with what's called, it's a Sanskrit word, it's called pragya parad, which can be translated is to the mistake of the intellect. And the way I translate that is how do you perceive something? How do you look at something? And the goal of Ayurveda is to create balance. So somebody could facilitate that, question that, well, if they're seeing something in a certain way as scary or fearful or happy, it's your perception, it's your intellect, it's how we're looking at things. So what I do as a counselor is I help to understand what the person is perceiving and questioning it, like a type of self-inquiry, asking questions, and then so they can go to deeper levels of truth. And so when someone finds their truth in Ayurveda, it's called, it's like a restoration of one's smriti, one's memory. So it's memory of their truth, memory of one's own pure essential nature. So when we forget about who we are, there's like a memory loss of some sort. And all the tools of Ayurveda help to regain this memory of our true essential nature, which is bliss. And all the treatments, the herbs, and all the different techniques all help to restore this balance, this memory of our essential nature, including how we digest and how we interpret the world around us.
Should we move on to the next slide?
Yeah, sure.
So let's talk about senses, from an Ayurvedic perspective.
Mm-hmm. Yeah, so in Ayurveda, one of the things that causes imbalance is overuse of the senses. So again, that's overstimuli, which aggravates Vata and all the doshas. So if we're watching too many, binge watching Netflix too much, or
Which
we're
doing right now.
I'm guilty of that. I just finished, the Queen's Gambit, but it makes you feel terrible, like if you're overdoing it, right? Like if you're using your senses but you're doing it in balance, you feel balanced. But if you're overdoing it, like you're checking, you're on the computer checking Facebook too many times a day, or emails, then you kind of feel like this Vata, like kind of scattered and unfocused, and it makes you anxious. So overuse of the senses can create the imbalance in all the doshas. So like you're overeating sweets, which has been with the elections and everything, people have the stress response, or maybe eating more sweets or whatever foods that they're craving. And then you start to feel, poor digestion, or you have that kind of kapha sluggishness that is happening. So the idea is balance. So check yourself. What am I overindulging in that in one area of my senses? And notice, like, how do you feel when you do that? And what is it? The question is, what is it that you're avoiding? Like, what is it that you don't want to feel when you're engaging in this overindulging of the senses? Usually there's something people want to avoid. So avoid feeling. So if you're checking, but it doesn't work, it actually makes you feel worse. So, what are some alternatives to that? So instead of, checking your text every hour or every 15 minutes, could you, it can make someone feel more anxious because you're overdoing that. It's an overstimuli. So you would have to just make a commitment to say, I'm not going to check my text for another 3 hours. I'll make a commitment to doing that, 3 times a day, or I'll only watch one show at night instead of 2. So it's a matter of, or I'll have 1 cookie instead of 5. So but it's, easier said than done. So what a counselor does, like myself, is I help people through it. And then I help people feel what they don't want to feel. But usually when you feel what you don't want to feel, you feel better. I know it sounds very contradictory, but it does. It really, really helps. And sometimes you need another person there to help you feel anxious feelings or depressed feelings or a feeling of loss. It's, because it's a human condition. Humans don't want to feel pain. We just run away from it. That's the cause of all addiction. So, but when you actually walk through the pain, it's a relief because it's a technique of mind-body connection, whereas addiction or overuse of the senses is a disconnect. So it might be painful a little bit more for a couple seconds or 5 minutes, but then it actually will dissipate. And I swear by that technique. It really works.
Do you have any example that you've done that on yourself or some other clients, or?
Yeah, it really has become kind of my sadhana, my own spiritual practice, to just like notice, like if I'm overdoing it, like, um, especially now when we're in, stay-at-home orders that is starting all over again. I could be overlooking, like, with email. And what I do is I feel terrible when I'm overdoing it. It just makes me feel anxious. So I said, well, what is it that you excuse me, what is it that you're avoiding feeling? What is the discomfort? And it's just like, well, I don't want to feel lonely, but checking my Facebook doesn't actually help make me feel less lonely. So I'll ask myself, well, what is it? What do I need? I need to call my friend Sue, and then I feel better. It's like for some reason I didn't think of doing that. Instead, I was doing this like unconscious sort of behavior. So really what we're doing is making the unconscious more conscious, the
Yeah.
unconscious behavior more conscious. And that's falls in the realm of, pragya para, that it's like mistake of the intellect. It's like we're perceiving things in a lack of a holistic way. And Ayurveda has a whole body of psychology. It's called Sattva Vijaya, or Sattva Vijayante, which is like victory over in consciousness, the light of consciousness, Sattva. So there's a whole body of knowledge. We probably don't have time to go over it too much today, but I just want to kind of put that out there because this technique of becoming more conscious is really, at the basis of it. And, I am using these, it's so individual. So like using it in psychotherapy, it could be like somebody comes in with anger issues. I had a particular client who just kind of snapped, kept, anger responses to his family. And I found out that, he was having like, what is it? Like these caffeinated beverages, like every hour, maybe 12 a day, which will ramp up any type of irritability, and a lot of, pitta aggravating foods. So, he learned to meditate. He got off the caffeinated beverages, and he was just feeling more normal. His skin started to clear up. So that's how I integrate that into a counseling session. But I often use this technique of moving forward, into the pain, because positive thinking helps a little bit, but if there's something else going on, then I can facilitate that experience. It's called focusing technique, where people, I help them hold their hand through the uncomfortable emotion, and then it can be released within 5 minutes, simply by feeling it and staying with it to the end of it. So it's really powerful.
Beautiful.
Yeah. Oh yeah, I was going to give another example of a clinical experience. Somebody had come in with severe post-traumatic stress disorder, and it was her first time coming in. She could not even look me in the eye. She was hyperventilating. So I just had her hold her. I told her, she didn't know anything about Ayurveda, but I told her to hold her pulse. So in Ayurveda, we do pulse diagnosis called Nadi Vigyan, but you can also do this on yourself to balance yourself. And I just said, please hold your pulse with the 3 fingers. And I said, I'm going to time it for 1 minute. So she was holding her pulse, and she started to breathe normally. And her first words to me were, I'm breathing, I can breathe normally. And she's, and that was like literally within a minute of taking her pulse. So there's all these little kind of tools Ayurveda offers for a variety of different, you know, anxiety issues, anxiety disorders, and sleep disorders, things like that.
We are open for questions. That was beautiful, Rose. Really beautiful. We are open for questions. You are welcome to ask questions. Type it up in the chat window or ask questions, and Rose would be happy to answer your questions. So what I was going to ask is, so you depending on each and every client when they walk in, or when you consult, so you will choose different tools, whether you want to use a body work like you talked about, Abhyanga, which is the massage, Shirodhara is the head massage or head oil that's poured into your head, and then you also use herbs, and then counseling. And so I'm just trying to understand the different tools. Like maybe you can just say, okay, different tools would be, one would be the body work, the other is herbs, the third is mental, like a counseling session, like combine all that. That's what I'm trying to understand.
Yeah, of course it doesn't happen all in one session. For example, somebody called who has a substance abuse addiction, and wanted some help with Ayurveda for doing that. It was long distance, so I couldn't help him in my clinic, but I had referred him to get treatments at another clinic, and he started to receive Takradara and Shirodhara treatments on a regular basis. And in 2 months' time, he reduced his substance level from 100% down to about 10%.
Yeah.
It went very quickly, of course, but he was ready. He wanted to change. So it always goes faster when you're highly motivated. But
Yeah.
so it could be like that, or it could be like somebody comes in for 5 sessions, and then like the first session we're just going, it's like an intake, we're going over into what the goals are, what people want. A lot of people don't actually know what they want, so I ask people how they want to feel. How do you want to feel? How do you want your day to go? So and then we look at what are the obstacles that are in the way. And then it could be, depending on the individual, maybe they start changing their diet to a more, Vata Pitta or Kapha pacifying diet, maybe I do recommend that they come in and get Shirodharas. Maybe they're recommended to learn how to meditate. They
Mhm.
be maybe recommended to have their Jyotish astrology read, and I refer that out to a variety of different people. So it just depends on the individual. Some people just need these focusing techniques and these counseling. They need to talk about it, trauma. I need to walk them through whatever
Yeah.
that they're going through. They may be experiencing grief and loss, and they need some extra support. So yeah, a variety of different things. It could be herbs too. Like there's different herbs like Jatamansi or Brahmi herb, different herbs to help balance the physiology.
Sure. So we have a question. Someone is asking, I feel I'm Pitta with a lot of anger. What tools can I use? Meditation, self massage, how to do it? It's a
Right, right. Yeah, okay. Anger is anger. It's
anger.
it's a very intense emotion when you're feeling it. So if I were to work with somebody who had a lot of anger, and it's hard to know without, having direct contact with you, like I'd want to know what triggers the anger, like
Yeah.
going into the trigger, like is it what people say? Is
Hmm.
it is it because you can't fulfill a desire that you want? What is the trigger? So finding out what is the trigger, and then understanding like, well, it's sometimes it's perception. It's like, what is the story you tell yourself when somebody says this to you? Like,
Yeah.
do you have a story that says you're bad? How is it feeding into the story you have about yourself? So, it takes some exploration into your own psyche, your own, consciousness, your own unconsciousness. And then, definitely you can look online at pitta pacifying diet and see, maybe some foods are adding to it. But
Mhm.
usually anger is about the story you tell yourself when somebody says something or you're not getting something you want. And so that's what I would work with that, with
Well,
anger.
the same person is saying it's from childhood trauma, from verbal, physical abuse. That's what this person
Yeah,
believes.
yeah. Well, in that case, it takes some time to undo that trauma. And there's a lot of like the Takradar and Abhyanga
Mhm.
uh, Ayurvedic treatments. I highly recommend, doing these treatments for that type of trauma.
Yeah.
That there's been over 350 peer reviewed studies on transcendental meditation.
Yeah.
So as much as I think of myself as a spiritual person, I'm also a scientist. I do like research studies, and they're teaching TM, transcendental meditation, to people who have PTSD.
Yeah.
And it's a very simple technique you can do twice a day. You can go to tm.org and try to find a teacher where you live. That's the first thing I would recommend for trauma. And then seeing a counselor who who understands what PTSD is, and you would feel safe enough to talk about and try to work with a counselor as well. So those are the things I would recommend.
Yeah, and we are actually going to offer. Rose has so much knowledge, so we are going to offer workshops at the beginning of the year as well, because Rose is amazing. So we have a question. Hello, Rose. Thank you for your time and a great presentation. Number one, there's a lot of question there. Could you speak a little bit more about the herbal supplement side for alleviating anxiety, stress? What are your typical favorite herbs, and how would these treatments differ across doshas? That's number one. We have only 5 minutes more left, so I don't know how much we can cover, but we'll try our best. These are educational sessions, small sessions. And then the second one is, what barriers do you see for acceptance in these treatments from gaining more popularity in US?
Yeah, US is a real challenge. I have to word everything. I have to have a whole informed consent. So I understand in the US it's pretty legally challenging to incorporate both of these things. So oftentimes I'm referring the treatments out from my clinic to wherever you live. And I do what I call Sattva Vijaya sessions. I don't call them counseling sessions. They're Sattva Vijaya, which is Ayurvedic psychology. But as far as products, I use 3 companies. Chandika, which is based in LA, and my Ayurvedic teacher, Vaidya Ramakant Mishra, is created all those herbs, herbal formulas. And he has a roll-on. So we often use transdermal herbs. That means it goes through the skin. He has a Jatamansi roll-on that I highly recommend for anxiety. It's excellent. And I also like using Marshi Ayurveda Products International, or it's called mappy.com. And they have something for anxiety. It's called Worry Free. It's a tablet, has Brahmi, Jatamansi, and I don't remember all the other herbs, but it's a wonderful formula that I think is excellent. It's not a cure for anything, but it does reduce it can reduce anxiety. Yeah.
Okay. And the US, I mean, these herbs are available. A lot of companies are offering these herbs, but still, there is not as much acceptance, or maybe there's lack of awareness. I don't know. What do you feel that why, people don't know enough about Ayurvedic herbal, or Ayurveda?
Yeah, I think, well, because Ayurveda is not licensed yet in the United States. So just there's people who just don't want to get on medications, traditional medications. So there is really quite a bit of interest in alternative treatment for depression and anxiety. Sometimes I do recommend that they see a psychiatrist. Some people need the medication. It's not across the board, but in some instances the medications don't work. So, the treatments are really powerful for this. Yeah.
Okay. Any other follow-up comment or question? You're welcome to. We have a few more minutes, so we can take a couple of more questions if you want to ask more questions. Any follow-up feedback from? Okay. Any comments? Any other comments? Anyone would like to say? I have stopped sharing, so no one can see what I'm just reading the questions from what you're writing. So it's not being shared with any FP or anything. So you're welcome to ask any questions. Okay, so sounds like no more questions. I would, all right. Yes, so someone is saying, I love all this. I feel a calling to learn more. Thank you. Yeah, like I said, we are thinking of, we are going to be offering a program like us. We want to offer group program actually, and tell us what you think, because we feel that if we offer group programs, people can talk at least, even if they don't see each other, but they can at least relate to each other having the similar kind of issues. So that's what we feel, that group programs would be more beneficial than one-on-one. You can always reach out, but group is something that we feel much more inclined. So let us know what your feedback is. That's what we are thinking. Okay, any other comments? I think I'm going to just wrap up. Before I wrap up, any other comments or any other final feedback? Okay. All right. So, thank you so much, Rose, for an amazing presentation. I think it's all of us need something like this during these uncertain times. So I really want to thank you for your time, and thank you. Someone is saying thank you. So you're welcome. And please, to all the listeners who are listening, please help us spread the word, help us share these sessions. And thank you so much, Rose. Anything else you want to add?
Thank you very much for having me. It was my pleasure.
Thank you. We'll be in touch. Thank you.